One of the things we always think about is whether or not the winter is going to be as bad as we had expected or anticipated, or could it be even worse? Truthfully, I am worried, and I tend to be worried almost every winter when COVID is circulating. Sometimes it's not as bad as I would expect, but I think it's inevitable that one of the winters is going to be horrific. I just don't know when. But what I'm going to be sharing with you today is some important information that has come from the Actuarial Society in Australia. And the reason why this is relevant is because it's important for these guys to get it right. And they have just passed through their winter in the Southern Hemisphere. And so we'll go through that in just a minute and give you some ideas to what I think is likely to happen. Now, before I start, as usual, just a reminder as you try and continue to support us, Disease X, are you prepared? We've just launched. Sadly, although we're still number one in viral diseases, new release, I think we're about number two or number three in this category. So please, your support is really valuable. And critically, we need your reviews. So if you've read it, we've got one 5-star review already. We need more, even though it's just been a few days. I know it's a big book, but yes, your support is really, really valuable. So let's get back to the point in hand. And so, in order to understand what we're talking about with regards to Australia, you again have to remind yourself about the geography. And the geography indicates here, this is Google Maps, just showing us here, down here is Australia. And it's extending over quite a large region. But the equator is just about right along here. And so, what you would find is that if you took Australia and you moved it into the northern hemisphere, it would be somewhere just south of Europe, covering North Africa. That's where Australia is. Now, it's a very important point to remember in that you don't expect the winters in this region to be as severe as it could be in Europe or even North America. And so, similarly, if you pushed Australia along over here, it would be the middle of the United States towards the lower end down to, say, Mexico. And so, when they have problems, there's a pretty good chance that this is going to be relevant to the rest of us. So, what is it that they were doing? So, as I said, the Actuarial Society, and this is the actual institute, Actuaries Institute, and they have lots of courses and information for actuaries in terms of life insurance policies, predicting the future, and so on. And so, this information or this kind of extrapolation is extremely important for them to get right. What did they say in this report that was published? You can see it here. And this was published on the 17th of December, 2024. Remember, they have just been through their winter. They're now coming into their summer. And so in this article, they have shown the excess mortality analysis for the first 8 months of 2024. That's just beyond their winter. It was total mortality 2% higher than predicted. COVID mortality was 70% higher than predicted, and non COVID respiratory mortality was 8% higher than predicted, with pneumonia deaths 14% higher. And compared to influenza, there are 5 COVID deaths for every death of influenza. This is really, really important because, as I keep saying, everybody is underestimating COVID. And if there is one lesson you should have learned by now, at almost every phase of the pandemic in 2020, in 2021, in 2022, in 2023, in 2024, everybody thinks COVID is over, and it's never over. This is not a normal virus. That's the reality. It is not behaving like a typical virus. And if you start to expect it to suddenly do that, you're going to get caught out. And that's part of the reason why Disease X was prepared, because I don't expect COVID to disappear anywhere soon. And you need to know and understand how best to protect yourself from the continuous re-exposure that is happening. So, for the actuaries, in terms of the life insurance industry, they have to pretty accurately predict why people are dying so that they can set their prices accordingly. And when they did their prediction, you can see here their weekly actual versus the predicted deaths. The blue line here represents the central point of their predicted deaths. There is a likely range of light blue, which follows along because they predicted as in the middle of their winter between June and July, there would be peak deaths. What they found actually, the actual deaths is in orange here, wherever you see that orange dot in terms of every week going along. And you can see that during the winter here, it was all the way at the top end of the range in terms of their predictions. So they realized that this is not normal. And actually, they found that it was higher in 2024 than it was in 2023. This is a really concerning trend. And as I said, if you then extrapolate that concept, you then realize that actually, if you've got to be careful in terms of presuming that everything is over. Now, I want to make sure that I put in their disclaimer here. So that you are aware that this is their information, their statistics. And so their excess mortality analysis is intended for discussion purposes only and does not constitute consulting advice on which to base decisions. We are not medical professionals, public health specialists, or epidemiologists. And so they are highlighting that this is not them predicting the future, but they are looking at it from a financial point of view in terms of the impact on their industry. And that's actually why I trust it, because they can't afford to get it wrong. If they get the premiums wrong, as such, it's going to cost them down the road. And so they are trying their best to make sure that they capture as much as they can in an accurate fashion. So, as we therefore come into the winter in the northern hemisphere, so now it's the northern hemisphere's turn. And you can see, based on what happened in Australia, and remember, they are technically located North Africa, Mediterranean, or Mexico into the lower half of the US, their mortality was already 2% higher than they had predicted. And when they broke it down, and I hope you can see this here, when they broke it down for 2024 up to the date, you can see here from COVID deaths, it was a 70% higher excess deaths. From pneumonia, it was 14% higher. And from other lower respiratory tract infections, it was 5% higher. And when they looked at all doctor certified respiratory deaths, it was 8% higher when you combine all of it. For the other diseases, heart disease, cancer, strokes, they found slight decreases over the time. But you have to then look at other unspecified diseases. Here was a 2% increase. And that's one of your bigger numbers. So I suspect that some of these numbers that appear to be lower are actually caught up with unusual presentations for which we didn't really get a clear diagnosis. And overall, in that mild winter environment, they had a 2% excess mortality. You're talking about an extra 2,200 people who died in that period of time, as higher than they had expected. So this is important because the population of Australia is 26 million. Compare that to Europe at about 300 to 350 million. At 2%, or what they predict as well, the actuaries in the UK, Swiss RE, predicted 3 to 7% in the UK. And so, depending on how bad it is, 7% across 60 million people, and you're talking about every year, I can't remember what the exact number is each year. That is a significant number of people. And so, you have to realize that what we're facing at the moment is a different way of people dying. And you have to think carefully about this and ask yourself the question: was the concern in COVID primarily because people were dying and blocking up intensive care? Or was it just the fact that people were dying? It's a really important difference because if people die and they don't block up the intensive care and they die from what appears to be unspecified causes, does anyone care? Are they concerned that the excess deaths is still continuing to be high, way beyond what was the pandemic? And you have to remember in Australia as well, they didn't face the early parts of the pandemic. They locked down completely, which is why Djokovic couldn't play tennis there because he was unvaccinated, so nobody could get in. And additionally, when you think about the fact that they vaccinated a significant proportion of their population before being exposed to Omicron, it then gives you an idea as to what is going on. It's a really important point to consider when we reflect on where things are in the Northern Hemisphere. This could be quite significant and quite serious when we look at the winter to come. So, as I said, always think about it and be prepared. This is why Disease X was put together. In effect, I want to give you the understanding of COVID in a way that you can protect yourself for the future. This is really what it's all about. Because, as I said, I don't think that COVID is anywhere near over. This is a problem that we are likely to see, especially in highly vaccinated regions. The variants seem to be evading the immune system there, high circulation, and this is therefore going to be a challenge, I think, for years to come. We have a long way to go, but the hope is that if we can prepare ourselves well, we will put ourselves in a position where we are not therefore at long term risk. Have a great evening. Remember to support us, and we'll continue to bring you and keep you up to date with all the news.